Hospitals are some of the most advanced places in the world, but medication errors still happen every day. So what's going wrong? A big part of the problem comes down to how medical orders are written, processed, and communicated. That's where something called CPOE, Computerized Provider Order Entry, comes in. CPOE allows doctors to enter orders like medications, lab tests, and treatments directly into a system instead of writing them by hand. Before systems like this, healthcare relied heavily on handwritten notes and verbal communication. That led to issues like illegible handwriting, wrong dosages, and missed drug interactions. And small mistakes like these can quickly turn into serious patient safety risks. CPOE changes this by standardizing every order, making it clear, complete, and instantly shared. The system can even catch problems before they happen. It can flag drug interactions, alert doctors to allergies, and prevent duplicate medications. When connected to electronic health records, it gives doctors a complete view of the patient. That means better decisions based on real patient data, not guesswork. It also improves efficiency, orders move faster, and workflows become more streamlined. And fewer errors means fewer denied claims and better financial outcomes. But it's not perfect. Too many alerts can lead to something called alert fatigue. And like any system, it requires proper training and integration to work effectively. When done right, CPOE reduces errors, improves workflows, and supports better patient care. As healthcare continues to evolve, tools like CPOE are becoming essential, not optional. If you want to better understand healthcare technology and how it impacts patient care, make sure to subscribe.